Welcome back to my YouTube channel Healthy Lifestyle with Saira. In today's video, we are going to talk about food poisoning, its symptoms, causes, and treatment options. Food poisoning, which is a type of foodborne illness, is a sickness people get from something they eat or drink. Major causes of food poisoning are germs and other harmful things in the food or beverage. Symptoms of food poisoning often include upset stomach, diarrhea, and vomiting. Symptoms usually start within hours or several days of eating the food. Most people have mild illness and get better without a treatment. Some food poisoning causes severe illness or complications. Symptoms of food poisoning. Symptoms vary depending on what is causing the illness. Common symptoms of food poisoning include upset stomach, vomiting, diarrhea with bloody stools, stomach pain and cramps, fever, and headache. Less often, food poisoning affects the nervous system and can cause severe disease. Symptoms may include blurred or double vision, headache, loss of movement in limbs, problems with swallowing, tingling or numbness of skin, weakness, changes in sound of the voice. Now I am going to explain what causes food poisoning. Infections with microbes, viruses, bacteria, and parasites cause most food poisoning. Harmful chemicals also cause some cases of food poisoning. Microbes can spread to food at any time while the food is grown, harvested, or slaughtered, processed, stored, shipped, or prepared. Some harmful microbes may already be present in the food when you buy them. Foods that may contain microbes include fresh produce, raw or uncooked meat, poultry, and eggs, dairy products and fruit juices that have not been pasteurized, heated to kill harmful microbes. Fish and shellfish, foods that people handle during preparation, such as sliced meat, salads and cut fruit, sandwiches, and baked goods. Processed and ready to eat meats, foods that are not properly canned or sealed. If you don't keep raw foods such as beef, poultry, seafood, and eggs separate from other foods, microbes from the raw foods can spread to the other foods. Microbes can also spread from raw foods to your hands, kitchen utensils, cutting boards, and kitchen surfaces during the food preparation. If you don't wash your hands, utensils, cutting boards, and surfaces completely after you have come in contact with the raw foods, they can spread microbes to other foods. Now I am going to discuss about the complications of food poisoning. In most healthy adults, complications are uncommon. They can include number 1 is dehydration. The most common complication is dehydration. This is a severe loss of water and salt and minerals. Both vomiting and diarrhea can cause dehydration. Most healthy adults can drink enough fluids to prevent dehydration. Children, older adults, and people with weakened immune system or other illnesses may not be able to repeat the fluids they have lost. They are more likely to become dehydrated. People who become dehydrated may need to get fluids directly into the bloodstreams at the hospital. Severe dehydration causes organ damage, other severe diseases, and death if not treated properly. Complications of the systematic disease. Some contaminants can cause more widespread disease in the body, also called systematic disease or infection. This is more common in older people who have weakened immune system or other medical conditions. Systematic infections from foodborne bacteria may cause blood clots in the kidneys. E. coli can result in blood clots that block the kidney's filtering system. This condition, called hemolytic uremic syndrome, results in the sudden failure of kidneys to filter waste from the blood. Less often, other bacteria or viruses may cause this condition. Bacteria in the bloodstream. Bacteria in the blood can cause disease in the blood itself or spread diseases to other parts of the body. Meningitis. Meningitis is an inflammation that may damage the membrane and fluid surrounding the brain and spinal cord. Sepsis. Sepsis is an overreaction of the immune system to systematic disease that damage the body's tissues. Pregnancy complications. Illness from the Listeria bacteria during pregnancy can result in miscarriage, sepsis in the newborn, and meningitis in the newborn. Now I am going to explain the treatment options for food poisoning. Treatment for food poisoning depends on how severe your symptoms are and what caused the illness. In most cases, drug treatment isn't necessary. Treatment may include fluid replacement. Fluids and electrolytes maintain the balance of fluids in your body. Fluids include minerals such as sodium, potassium, and calcium. After vomiting or diarrhea, it's important to replace fluids to prevent dehydration. Severe dehydration may require going to hospital. You may need fluids and electrolytes delivered directly into your bloodstreams. Antibiotics. If the illness is caused by bacteria, you may be prescribed an antibiotic. Antibiotics are generally for people with severe disease or with a higher risk of complications. Antiparasitics. Drugs that target parasites, called antiparasitics, are usually prescribed for parasitic infections. Probiotics. Your doctor may recommend probiotics. There are treatments that replace healthy bacteria in the digestive system. This is all about food poisoning. If you like my video, please subscribe my channel, and for any health related question or query you can ask in the comment section below. Goodbye.